The Public Health Agency of Canada has an entire bureaucracy called the Pandemic Instrument Team, and they've just sent out an update on the World Health Organization's pandemic agreement negotiations.
The WHO is going to need more resources to have a dedicated team, not just for when the epidemic comes, but to go to the world's countries and make sure that these drills are being done. We do fire drills. The Defense Department does war games. We need for epidemics to practice. In fact, one of the reasons why Australia did well is that it, like Taiwan, was threatened by SARS-CoV-1. And so this idea of, okay, who are these PCR people? How do you get them engaged? It was partly practiced because of that previous threat. And so we need to be doing every 5 years a really comprehensive exercise at both country and regional level of pandemic preparedness. And you need a global group that's kind of scoring everybody and saying, hey, if you're not participating in this, you could be the source of the next pandemic. And that's bad for the entire world. This is like a fire that goes global.
On June 12th, an email was sent out by the Public Health Agency's new Pandemic Instrument Team with the status of the World Health Organization's pandemic agreement negotiations. Anyone who has signed up for the Health Canada and Public Health Agency of Canada's Stakeholder Registry can receive these updates, the email said. Canada has been working with other World Health Organization, WHO, member states to develop a pandemic agreement. The goal of this agreement is to help nations prevent and minimize the devastating health, social, and economic consequences of a potential future pandemic. On June 1st, 2024, at the 77th World Health Assembly, member states adopted a resolution to extend pandemic agreement negotiations up to 1 year and to submit the outcome before or at the 78th World Health Assembly, which will be held in May 2025. Canada is committed to the pandemic agreement process and to supporting multilateral cooperation on pandemic prevention, preparedness, and response. We will also continue to engage with Canadian partners and stakeholders to ensure that Canadian priorities and values are reflected in the pandemic agreement. More information on Canada's role in the development of the pandemic agreement can be found on the Government of Canada's website, and then the email is signed off by the Pandemic Instrument Team. Now, the link directs to this page, which describes the pandemic agreement as a way to strengthen global pandemic prevention, preparedness, and response. The page confirms that the powers that be haven't been able to even agree on what to call this thing: a pandemic agreement, pandemic instrument, pandemic treaty, or a pandemic accord, and that its development is expected to take until at least 2024. Yet we're more than halfway through 2024 and a name hasn't even been finalized, or perhaps this website, last updated in February, is simply outdated. Now, according to the Pandemic Instrument Partner and Stakeholder Engagement Forum, published in August 2023, the breakdown of participants did not include any regular Canadian citizens. Participants instead included broadly defined academics, experts, and researchers, provincial, territorial, and Indigenous departments of health and health authorities, health and allied health services sector, youth, private sector associations, and non-government organizations and non-profit organizations. Of course, big pharma and biomedical technology data harvesting companies were there. Long-term commitments are described as open communication and information sharing, transparency and accountability, collaboration for enhanced PPPR, pandemic prevention, preparedness and response, funding and building capacity, and of course, ensuring firm commitments for a unified global response. That means more binding commitments that prioritize public health. But what happened when we prioritized public health throughout 2020 and 2021? It meant the mass decimation of small businesses and economic shuttering from supply chain issues and leading to the inflationary period most of us are suffering through today. It also saw the largest transfer of wealth that meant billionaires got richer at the expense of small business owners, something even the oligarchs at the World Economic Forum acknowledged. The public health response that saw the unprecedented shuttering of schools, forced isolation of children, and locked them out of sports and extracurriculars that caused mental health issues, disproportionately affecting said children and young adults. Masking that caused its own set of issues, from dehumanizing communication skills to hindering language development in our youngest demographics, not to mention depriving everyone of the ability to breathe unfettered, necessary fresh air. The impacts of prioritizing public health above all else were in direct contravention of a healthy democracy, and these self-proclaimed stakeholders sound like they don't have any skin in the game, other than all benefit and little risk. Now, while the government claims that the WHO has no jurisdiction in Canada, we saw very early in the pandemic an advice such as this from Public Health Ontario that the World Health Organization was being extensively sourced to back up the knee-jerk and non-evidence-based health diktats being indiscriminately applied to the general population. While the WHO moves to strengthen its mandate, giving sole direction to declarations of pandemics or public health emergencies of international concern, as Director General Tedros Adhanom Ghebreyesus has put it, this decision will fall squarely on his shoulders without any oversight or adherence to democratic due process. And Tedros bordered on hate speech last month at the 77th World Health Assembly meeting, where he said that the world needs to strategize against supposed anti-vaxxers, blaming them for creating havoc throughout the COVID unfolding.
Serious challenge that's posed by anti-vaxxers. And I think we need to strategize to really push back because vaccines work, vaccines affect adults, and we have science, evidence on our side. I think it's time to be more aggressive in pushing back on anti-vaxxers. I think they use COVID as an opportunity and, all the havoc they're creating. Maybe that's one of the messages also I would like to include to whatever I have said.
Is vilifying, scapegoating, and maligning an identifiable group of people something that a purported leader of global health should be doing? Why is our country backing an individual and the private organization that he represents? And who voted on any of this? For Rebel News, I'm Tamara Ugolini. Please stay up to date on our reporting on this topic at nopandemictreaty.com. There you can sign our petition, sign up for our emails, and of course, support our journalistic efforts if you're able to contribute financially. All of that at nopandemictreaty.com. Thanks for your support.